Here we are at a pivot point. 3 years of publishing research, working with clients, and now podcasting of all things. The U.S. ideal healthcare system. I think it works. Opening statements. We live with systematic dissatisfaction, widespread dissatisfaction. We've slogged through. There's an obvious reason for the dissatisfaction. We have fatal flaws in the system. It doesn't work. Everyone's considering potential incremental improvements. We're keeping the status quo and just tweaking it. Doesn't work. And we've looked with two specific success examples, one with an employer, which is a continuation of 50 years of work, the federal government case, which is also a continuation of decades worth of work. Here's the startling catapult into what's possible. I'm going to read this. The plan for the future on the next slide is bottom up, individually health focused. Our big top-down production and financially driven system has naturally selected current winners. Wow. Big health systems, big pharmacy, a few final insurers, Medicare, Blue Cross, United, Aetna, Cigna. Primarily Blue Cross and United, and add to that Kaiser and some other regionals. What's the catapult? Blue Cross in the 40s was a local, direct relationship driven, not-for-profit, where Baylor approached the school system and said, for so much a month, we'll take care of your people. United, a Minnesota TPA, formed the not-for-profit Physicians Health Plan in 4 Michigan locations. Worked so well, you got what we got now, United. Figured it out. And Kaiser, we all know Kaiser, commonality. Local, not-for-profit, shared risk among stakeholders, and wow, what a foundation. We're going to capitalize on it. So we roll it all together and go out on a limb and say, here's what an ideal U.S. healthcare system could look like. Not surprising, it's that individual support team as number one. It relates to the local health system that fits the population and their resources and what that population can support. Connects then with regional stakeholders that are centers of excellence that treat the complicated diseases. So that set of teams takes a person at their home, looks after them, either goes through the local system or straight to the centers of excellence and back home after the episode. Integral to it are the stakeholders of insurers and health plans who primarily are in the administrative business, because we've seen that risk at the stakeholder 6 level doesn't work well. So here's how it works. Individuals are always number one. Better health, better healthcare, better cost. Personal health nurse, a truly unique relationship and resource that's not used in the current healthcare system, and the whole thing probably pivots on them and their leadership. From there, the social determinants of health integrate with all communities, and that we have seen how that fits with local and state governments so intimately. Primary care, a major flux, key connection between health and medical treatment, and information that is life and health focused, relationships, interaction, integration with overall healthcare system, helps people move through the system. The local healthcare setting that fits the population, ranging from large but critical access hospitals. We got a lot of them, and they're all on bubble, and they need what we've got here. Centers of excellent in treating serious conditions, and insurers and administrators. Risk complicates, goes back. Risk-wise goes back to stakeholders 2, 3, and 4. So how does this look? Financial stakeholders who pay for services, individuals, employers, governments, and all want better health, better health care, and lower cost. And this process fits together in a way that will allow that to occur. So there we have it. Summary statements. We've gone out on a limb. We have said, here's an ideal U.S. healthcare system. So simple to diagram. Almost impossible to actually implement, make it work. But we're going to look at the end that says, oh, yeah, we made it work. Numerous times over decades. Leadership comes from all levels, but it has to be leadership focused on good health and healthcare. It's a universal need. I continue to believe that this approach is very unique to rural populations, and it's something that's going to be with us for the next 100 years. Really has to be addressed immediately. 3 obvious realities. Challenges are more about resources, which are people that can do things rather than financial arrangements. Most of our incremental change has been focused on let's put financial incentives and disincentives for behavior. Man, it doesn't work when you're sick. Nursing and leadership is critical and is a must have. A lot of this pivots on the 4 million RNs we have in this country and what percentage of them want to step up and lead health and healthcare in their communities. And then we have the integral nature of health, healthcare, and social determinants. They are so integrally aligned, it's just amazing. So it can be done, depends on local leadership. When I say it can be done, I'm going to mention that I've had success over multiple decades using whatever tools were available at the time, working the employer side of the street or working the health system side of the street. The 10 things, the 10 management things that you do and the nursing stuff just works, and information. So in this study, we've shown current employer and government case studies. We have the employer amazing results, and the government case study in Delaware is amazing. And you put all those together with various government levels, it just gets more and more persuasive. So, Harry, give me some longer term stuff. We built Informad from 2000 to 2012. So Conifer, go to that website and look at their stories. Still doing the same stuff. It actually really works. In the 90s, we built WebTPA to support hospitals going direct to their communities. Did a .com raise at the worst possible time in 99, 2000. It was valued at 80 million, then it was valued at 60 million, then it was valued at 25 million. We raised 8. I don't think the whole thing was ever worth more than 8. So anyway, bon voyage. This has been quite a ride, and it's time to get on with it and make some stuff happen.